Do you have a pet that has itchy skin? Maybe they have chronic ear infections. Maybe their anal glands keep flaring up and you just can't get a hold of it. It's so frustrating. You're in and out of the vet clinic and nothing is working, nothing is improving, and you just don't know what to do. You may actually be contributing to your pet's distress because of the food you are feeding. I'm Dr. Katie Woodley, the natural pet doctor. This is our weekly coffee talk with the doc. And today we are talking about skin disease and how the food you are feeding your pets may actually be causing an issue that you don't even know about. So I want to start with talking about what is the difference between food allergies and food sensitivities? Because there's a common misperception that these are the same thing, and they're not really. And so when we're talking about food allergies, what's actually happening is the body's producing the antibody IgE, and this is to fight off the food allergy. And this is where the body actually reacts immediately, it reacts violently. So for example, you take your pet in for a vaccine, you give the vaccine, and all of a sudden they start vomiting immediately, like within 5 minutes. They're not doing well. They don't stop vomiting. They need like steroids. They need supportive care. That is an allergic reaction. So anaphylaxis is what we're talking about when we're referring to a food allergy. This is rare. So this is not what I'm talking about because this is not common in your pets. What we're going to be talking about is a food intolerance or a food sensitivity. And this is where there's a response to a particular food or a compound, so typically like the proteins in that food, that can be found in maybe a range of foods that's often exhibited through the skin, through the bowels. So things like diarrhea, loose stool, gassiness. And in contrast to those food allergy reactions, which occur immediately, that's that anaphylactic reaction, the body actually produces different antibodies. So that's your IgA, your IgM, to combat the food sensitivity and the intolerance. This type of reaction can be a lot more common, and it can also be a long-term reaction. And it can also be delayed. It can be frustrating to find. And this can be really frustrating for veterinarians, especially if you don't understand the concept between a food allergy and a food sensitivity and how the immune system can behave very differently. And also, what are some of the factors that can prime that body to actually develop a food sensitivity and an intolerance? A common misperception too is that you have an older pet. Why would my pet develop a food sensitivity when I feed the same thing over and over and over again, right? Common question that a lot of pet parents are asking themselves, like, how could this be possible? So let's talk about, okay, why do these sensitivities result? So as I just mentioned, it's kind of like it could be a lack or an absence of certain enzymes or chemicals that your pet needs to digest its food. And what can happen is we can put things into our pet's body that lead to inflammation in the gut, lead to things like dysbiosis, leaky gut, leading to malabsorption, which can then result in inflammation in the skin. So when your pet eats food, what happens? The food is digested first in the stomach. So large pieces of food are broken down. Hopefully your pet has digestive enzymes. If you're using things that reduce stomach acid, listen up. You've got some tips for you because a lot of animals are on things like Prilosec, digestive enzymes, because they get GI upset, and it may be a food intolerance. So I'm going to give you some tips at the end that you can look at your food and assess, is my food causing inflammation in my pet? But these large pieces of food, whether it's kibble, whether it's fresh food, whether it's a raw diet, raw meat going into your pet, are broken down into smaller pieces of food in the stomach. And those enzymes are breaking down those larger complex proteins into smaller structures. Because then what happens is that partially digested food then moves into the small intestine. And this is further broken down. So those proteins are further broken down into smaller amino acids. That's what's absorbed by the enterocytes. So those functional cells in the gut that are absorbing the nutrients, those amino acids. However, if whole proteins are being absorbed, the body's going to go, whoa, this is not normal. We're going to create an inflammatory response. We're going to see those IgA, those IgM antibodies get stimulated to bind to those complexes. But then what happens? It gets sent into the bloodstream. The immune system goes, whoa, and we get a massive inflammatory response, and that can lead to inflammation in the skin. So that's where this immune system's overstimulated by the food, leading to an inflammatory response. That's inflammation. That's where we can see your pets get itchy, red skin, their ears get inflamed, their anal glands get inflamed. They can't push out that gross anal gland fluid now, and they get impacted, and you have recurring anal gland problems. You have recurring ear issues. Your pets are licking their feet, and you're like, why is this happening? And it's because of something happening in the gut a lot of times. And we focus on external. And so what do? We start treating with like Apoquel, Cytopoint. We're putting creams and ointments on the pet and it goes away. We're using ear medications, which are all necessary to help make your pet more comfortable. And there are a lot of holistic options that we can do. However, we're missing the point. We completely miss the point that the problem is actually in the gut, that the problem could be related to the food. And then what happens? And you may be experiencing this and you may be like, I'm actually on this like vicious cycle of I go into the vet, I get the drugs, my pet feels better, I come off the drugs, they're okay for a little bit, and then they flare up again. And you go through the cycle, and you may be going through the cycle for life. And it gets worse and it gets worse and it gets worse. And you need more drugs, more drugs, more drugs. Then you get more side effects, more side effects, more side effects. And then you have drugs to treat the side effects. And all we did was ask the wrong question. And it's because we look at medicine from a conventional perspective, rather than saying, what was the problem? What is the problem? What is the root cause of the problem? We said, my pet is itchy. What remedy do I use to treat the itch, to treat the symptom? So we miss the problem. We miss the problem that caused the symptom. And so we're treating the wrong thing. And that's why it never goes away. But that's why I love holistic medicine, because it makes you look for the root cause and ask those better questions. So that's what I want you to do. If you have a dog, you have a cat, and you're on this vicious cycle and you're just like, God, I'm spending so much money. I'm watching my pet feel uncomfortable. They're scratching themselves raw. I am so frustrated. What the heck do I do? Ask yourself, why is this happening? What could be going on? And here's the thing. There can be a lot of different reasons for allergies, for itchy skin. Food can be one component of them. Some of the other common causes of sensitivities, so allergies, skin disease, itchy skin, ear problems, can actually be parasites. These can be actually the number one reason. So what can happen is we're not ruling out fleas, and it could be just one little dang flea, and those things can be really hard to find, especially if you have a fluffy cat, fluffy dog. They're fast, they're hard to find, especially if you have a dog that has lots of fur and they're dark. It can be really, really difficult, but your pet could be really sensitive to the flea saliva. And when they're bit, they have this massive allergic response. And what I find people doing is that they go on this merry-go-round of trying different foods, and they're like, it's got to be the food. It's got to be the food. It's got to be the food. I'm going to try this food, this food, this food, this food. And you end up spending hundreds of dollars on different foods and wasting different foods. And it wasn't the problem in the first place. So we have to keep in mind the other causes of skin disease and rule those out. The other most common cause of skin disease in dogs and cats is environmental allergens. And so these can play a part, and this is where pollens, grasses, even dust mites in your house. So no matter how clean your house is, you can still have dust mites. There can also be like food mites in kibble storage, like storage mites in the kibble food. And that can be a big problem also. So if you are feeding a kibble diet and you have a pet that has sensitivities, it could be related to environmental, but the problem is actually in the dry food, even though they may not have a food out like sensitivity. So there are tests that you can do that I recommend doing. There's the blood test where you can look for environmental allergens and see what your pet is sensitive to. You can also do the skin prick test with your dermatologist, where they actually sedate them and they get like shaved and they get the little pricks and they form little like welts if they're allergic to it. So that's going to be your more intensive diagnostic. But if you have a pet that has skin issues and they're not going away and you're sick and tired of using conventional medications, take a look at those tests. Ask your veterinarian, hey, can I do these tests to rule out this underlying problem in my pet? That's really important. The more information we have, the better we can treat the root cause, because we can figure out, is your pet have an environmental sensitivity? Does it have a food sensitivity? And both of those can occur together, which makes it even more fun and exciting, because now it's like a little hunt that we have to go on, but we have the test to rule those out. So we need to be using that. That's how we know what's causing it, the diagnostics, rather than trying elimination trials, rather than using all the drugs that are only treating the symptom rather than treating the cause. Because if we don't figure out what is causing it, and we're using things like Apoquel, and there's a time and a place for those drugs. I am not against using them, especially if your pet is chewing themselves raw. They have really bad ear infections. It can bring down the inflammation while we heal the problem. So it makes your pet more comfortable. And as we start implementing diet changes, as we start using more holistic remedies and natural remedies, we can start lowering the dosage of those drugs. And we can see how your pet is responding. So there is a way to integrate both conventional and holistic together and heal the root problem so that the symptoms go away. Hey pet parents, I hope you enjoyed this video. If you did, would you please hit the subscribe button below and post any questions you have down below. Also, if you'd like to join us on our next live training to learn more about holistic health in your pets, then click the link to join our Natural Pet Tribe to gain access to live videos every month with me and the ability to ask me questions. I'd love to give you more education and interaction to help your pets thrive naturally. Until next time, please subscribe and share this video with other pet parents that may need help and guidance to help their furry family members live a long and vibrant life. Thanks again for being a part of our community.